Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists. Well, everyone, welcome to an interview that I know I'm excited about. I've been diving into this topic and this company for a hot minute, and we're going to be talking about Perio Protect Trays, which could just be Perio Trays, I think, because I tried to say Perio Protect Trays, and it just doesn't work out for my tongue. So I'm excited to welcome Charissa. Sorry, I knew I was going to mess this up.
I always say my mom was not hooked on phonics. Yes. Charissa Wood.
Thank you so much for coming on and chatting with us today.
Absolutely. It's my pleasure, and I really appreciate the opportunity. I have been using Perio Protect for the last 8 years. I might be their biggest fan, and I love talking about it endlessly. So hopefully I can give you guys a whole lot of information and help your listeners really get plugged in.
Oh, I'm sure. So tell us about yourself. So you're a hygienist, correct?
I'm a hygienist. I've been a practicing hygienist for the last 24 years. I worked my first 14 years at the same office, great, just general practice. And then life kind of necessitated me picking up an extra day, and I shifted over I'm now at Atlanta Dental Spa. So I live in Woodstock, Georgia. I'm in a little suburb outside of Atlanta. And when I made that shift, I kind of got introduced to a new culture of really paying attention to the oral systemic connection. You know, as a hygienist, we know that the mouth is connected to the body, and we know there's, a lot of research and data out there. But I was exposed to it in a really deep way. We got really connected with AOSH, which is the American Academy of Oral and Systemic Health. I was actually a founding member of that board up in Wisconsin. And just everything that I learned took me to a place where I couldn't unlearn that, and I couldn't unknow that. And the weight and the responsibility I felt of really taking care of my patients and really understanding that what I'm doing in their mouth has a direct correlation to what's happening in their body. That's something I couldn't walk away from. And so it kind of shifted my career from being a job that I really liked to a passion that I absolutely love. And so into that mindset of oral systemic connection, kind of entered in the concept of Perio Protect Trays. And, one thing I really love about my job is that I get to share the oral systemic link with my patients and help them understand their own risk factors and help them make the best decisions for themselves. And obviously, I think that using Perio Protect is one way to really, really decrease their risk factors and really increase their total overall health. I'm also really passionate about sharing that with other hygienists. And I have teamed up with another great hygienist down in South Florida, and we are actually rolling out a really exciting book that should be released in 2021. Look out for it. It's called Bulletproof Hygiene. We're going to have some really cool training videos linked up to it. And we do talk a lot about Perio Protect in that too, because we both use it in our practice and feel really strongly about it. But getting back to the oral systemic connection, the research is insane with showing, there are 57 different systemic conditions that they have tied to periodontal disease. And so, our old school paradigm of addressing and treating periodontal disease is basically, NSBT, scaling and root planing. As we know, that creates a lot of bacteremia. And so what I know and understand about periodontal disease is it's obviously bacterially driven. We incorporate salivary testing in our practice, which I love because I can see exactly what we're dealing with and help the patient see what that load looks like. But I know there's, about 12 different types of oral bugs that they've definitely shown through research to be, in some cases, a causative agent, as well as just, kind of increasing the inflammatory condition throughout the body. But for things like heart attack, stroke, arthritis, diabetes, certain types of cancers. And so with that on my mind, when I have a new patient come into the practice, I'm really paying attention to their medical history. I want to know what that looks like, their personal medical history and their family history as well, their background, because I want to know what those risks are. And I know sometimes we don't always know that answer. They may not always know that answer, but that's something I always take into account. because I understand that when I get in there and I am doing any kind of procedure, if I'm inducing bleeding, I'm introducing all those bacteria into their bloodstream. So what I love about Perio Protect Trays, what they do, let's talk just for a minute about how they work and what they do. Basically, they are trays that are made to custom fit over the patient's teeth and the gum line. It literally creates a seal around the gum line. Basically, it's like a hyperbaric chamber for the mouth. And it utilizes a 1.7% peroxide gel. You just put a thin line of gel around the tray and place it into the mouth. And because of that seal, it hydraulically forces that gel into the base of those pockets, all the way to the sulcus, up to 10 millimeters. Because we are dealing with anaerobic bacteria, when we can oxygenate in that sulcus, it pops the cell wall of those bacteria and creates a community that those anaerobes cannot continue to live in. So it's a really non-invasive way to address those bacteria in every single nook and cranny. It also addresses it without creating any of that bacteremia issue, because it addresses it at the site without inducing bleeding. So something else that's super exciting that a lot of people don't realize that we have the capability to do this is we can actually utilize liquid vibromycin as an antibiotic in the trays as well. And because it is topically used, the patient's not ingesting it, it's just topically used in the trays, it's actually being used as an antioxidant, and it stimulates the osteoblast to lay down new bone. And I have seen this happen. In fact, I had one of my doctors get on to me for using the trays with the vibromycin, and he said, hey, from now on, if you've got a patient that you know down the road you want me to take wisdom teeth out on, please don't give them the vibromycin, because it makes it super duper hard to get them out.
No.
Yeah. So it's great if you've got some patients that have some mobility going on. It's amazing for patients who have, made investments in implants to, really protect and keep those really stable. But that's a really cool feature that, we haven't had in the past. We've always told patients, once you lose bone, the bone's
100%.
gone. Mm-hmm. Yeah. So it's really exciting technology to use from that standpoint. A lot of times, people are curious. I've had some really great success stories with this. I have seen multiple patients who've come in as diabetics. And, I always ask, what was your last A1C? Are we under control? What are things looking like? And I educate them on the connection, obviously, between periodontal disease and diabetes. A lot of patients aren't really aware of that. But we talk about how these trays, because they are reducing the inflammation, they are reducing, obviously, the active infection, they're going to see their blood sugar levels go down because their body's no longer fighting this chronic inflammatory condition going on in their mouth. So I have watched many, many patients whose A1Cs have dropped from, an 8 to a 6.3. So it's pretty incredible. And that motivates the patients to continue using it. I had a patient not long ago that came in and she was telling me she loves to golf. She's retired, and that is her thing. She gets together with the girls and they go golfing. And she said, man, I haven't been golfing as much lately because I've been really hurting. I have arthritis and I'm in the middle of a really bad flare. So I got in there and I looked around, and she definitely had some periodontal flare as well. And we talked about all those correlations. And I don't know if you guys know that the research shows they have seen PG bacteria actually initiate arthritis in the joints. So I shared that with her and I said, you know what, honestly, I don't want to get in there and disrupt any of this with you already being in a flare. Let's do some salivary testing, see what we got going on. And then I talked to her about, using Perio trays to address this issue currently, as she's in an acute issue, and then long-term to maintain so that we really are able to keep any of that from hanging out and residing and exposing her to that. So it was really amazing with the salivary test results. They came back and she was off the charts with several different things that are all involved with arthritis. So we did start with a systemic antibiotic just because of, she was way above threshold on those. And she reported back when she came back to pick up her trays, to deliver her trays, she said to me, I already notice a difference and feel better. And I'm super excited. I haven't seen her back since she has had her blood work done again. But I'm really curious to see what those inflammatory markers look like for her. But she already says, I feel better. I'm out on the course. I'm hitting the balls. So that's super rewarding as a, clinician to be able to really help your patients, not just with their oral health, but their quality of life. I had another patient who was very similar. She came in and she was kind of in a depression state. And she told me she used to sew all the time. That was her hobby. That was her thing. And she hadn't done it in a long time. She just wasn't feeling well. And it had been, honestly, I think it was about 8 years since she had been to the dentist. She had a lot of anxiety, a lot of dental fear. So perio trays are great for those patients too, because they're scared of a pain aspect. So to just put in trays a couple times a day initially and get that infection under control, that's super easy for them to do. And it doesn't hurt at all. So she went through that process, and I'll get into it that perio trays are not end all be all, they're an adjunct. But in using those for her, she got her life back. I won't forget the day that she came back in and she said, Charissa, I'm sewing again. Like, I feel great. This is amazing. And she had no idea that she had been undergoing this chronic inflammation for years that was keeping her down. So obviously that was another super rewarding one.
And what I'm hearing, I have been on a real kick the last few years, and Andrew has heard all of my rants about, like, we are more than a scaler in our hand. Hygienists and the dental team can make huge efforts without picking up a scaler.
Absolutely.
And unfortunately, we're in the state, in a pandemic that I have not been using aerosol generating procedures. I have had to go back to my hand scaler polishing ways, and it kills me. But right. I'm also continuing to have those bigger conversations with patients about biofilm management and managing the bacteria in their mouth and their overall health and sleep and airway and parafunctional habits and parasomnia. Like, we can change their lives.
Correct.
And never pick up a scaler. And that's all I hear from you. Like, I'm hearing the amazing things, but I'm hearing you, solidifying that thought for me.
I mean, for me, it's in my golf game is going to get better. I mean, that's what I'm hearing also. My sewing
Andrew,
and my golf game is going to be elevated.
That's right. You're going to be right on point. And to your point, Michelle, I will say one interesting thing, there's some interesting studies out as far as, because we are in the middle of a pandemic and specifically for COVID. So, the American Dental Association has allowed us or recommended for us to do a pre-procedural rinse using a diluted peroxide because they've seen it burst the envelope on the virus. What they've seen is, obviously it's a respiratory droplet virus that we get through our eyes, nose, and mouth. The first place that it attaches is our salivary cells because it is an ACE2 receptor, which is what that virus attaches to. So when you have your patients that are very concerned about COVID, the Perio Protect Trays are another way to battle that, not only from the aspect of obviously keeping your immune system in a really great place because you're battling any kind of inflammatory issues, but also killing off any COVID that you might have hanging around in there. So it's, kill two birds with one stone.
Absolutely.
Yeah, for sure. The other thing I'll say is I had another patient who was really, really battling with psoriasis very badly on his face. His wife actually sent him in because she was kind of embarrassed for him. Like, she knew he was kind of hiding himself away, and it was really, really aggressive. And he was doing like photo laser treatments on his face, and he had all kinds of stuff going on with that. But we got in there and he had very active and pretty severe perio going on. And once we got that under control, he noticed a huge difference in that. So it's a huge, and because it is an inflammatory condition, when you can turn that inflammatory system down, it changes everything. It is a total game changer. One thing I'll say as far as, a lot of people ask who are candidates for Perio Protect Trays. Honestly, I would say everyone, because who doesn't want to have a super healthy mouth? I wear them myself. I don't have periodontal disease, but I don't want any anaerobes hanging out in there. So I recommend them for everyone. But obviously, if you're just kind of looking into this and wondering, a great start is obviously for your active infection periodontal patients. And I honestly really recommend it as initial therapy to my patients, again, because of the oral systemic link. I want to make sure that I'm turning all that down. I'm killing all that off before I get in there and start stirring stuff up. So I still will perform scaling and root planing. I just typically do it after they have worn the trays for a month or so that I know that we've really kind of addressed the issue right at the root. Obviously, your patients who are perio maintenance patients, maybe you're still seeing them, every 3 months, and there's still some bleeding, there's still some inflammation, there's still some tenderness. We're not truly maintaining health. It'll get them there. The patients who have made investments in implants, like I said, it's a great treatment for implants. The only thing that's going to take an implant out is bone loss. So if we can prevent that and, build some bone stabilization, that's a really great use. And then obviously any of your high risk patients, anybody who's got a strong family history of heart attack, stroke, arthritis, diabetes, Alzheimer's, or somebody, who has a personal history of any of those or current conditions like that going on. Another great way to use them, and I always tell my patients the side effect of using these trays is that your teeth get whiter, and they kind of double take. I'm like, I know we usually think side effects are bad things, but this is a good one. Because it is a peroxide gel, it's a low grade, it's a 1.7%. So it's going to take a little while, but it will get them significantly whiter after they've worn it for a couple of months.
So wonderful side effects.
Yeah,
I know,
yeah.
right? Can we even call that a side effect? I feel like that's not even fair.
But you got to promote it because in their minds they're like,
benefits.
oh, I'm actually, I'm actually killing two birds with one stone
Protect.
here. Yeah. It's also great if you've got those patients who have perio but also have a high decay rate. You've got those patients who have a lot of recession, a lot of decay in that recession. It's so great to use a fluoride gel in the tray because, again, it's pushing that all the way down below the gum line and holding it against those roots. So you can use it for different things. The only thing you want to be careful about is you don't want to use any kind of oils in the tray because that will kind of loosen and break that seal and keep it from, doing what it should be doing.
So hold off on the coconut oil.
Correct. Yes. No oil pulling and then wearing your trays. Yeah. I think the jury's still out on that one anyway, right?
Is it?
Yeah.
Is it out?
Depends on who you ask, but yes, for most of us.
You're right. Yeah. So I want to talk a little bit about the process of how to enroll perio trays. A lot of patients will say, well, how come I've never heard of this before? Tell me about this. So the way that I usually talk to patients about periodontal disease and in incorporating the trays is, I'm doing my comprehensive exam with them. I am calling out the numbers so they can hear, they understand what those numbers mean. I'm showing them the bone loss. I'm showing them the redness. Basically, we're kind of co-diagnosing this together so that they can see and understand what the issues are. And then I explain to them that this is a bacterially driven disease by anaerobic bacteria, and it's all about those anaerobes setting up camp below the gum line. Underneath the gums, it's warm, moist, and dark, and there's not a lot of oxygen. So that's where those bacteria want to set up. When we have 4, 5, 6 millimeter pockets plus, you can no longer reach those areas with your toothbrush and floss. So you're working really hard for what you can reach, but where you can't reach, those bacteria just tend to continue to rebuild and collaborate, and they continue to dissolve that bone underneath the gum. And so these areas get deeper and deeper, and it's a progressive condition. So what I propose is that we use something called Perio Protect Trays, and I'm going to take a digital scan of your mouth. I'm going to send that off to the lab. It takes about 3 weeks to get back to us, and I'll see you for 5 to 10 minutes. That visit is just a tray delivery where we try them in, show you how to use them, how to take care of them. And then you're going to wear these trays for 10 to 15 minutes, 3 times a day for a month. And I know that sounds like a lot. I know that's a lot of new in your schedule, but I want you to embrace this as we are dealing with an active infection going on in your body. And this is what we need to do to get it under control. It's just a month. When you come back and see me at the end of that month, I'm going to reevaluate the periodontal health. At that point, I expect to see a reduction in pocket depth and in bleeding already because we've addressed the root cause. I will then, based on what we're seeing, get everything cleaned up and do what we call some scaling and root planing, where I make sure we get, any buildup that's below out. I'm going to flush out these, kind of the dead stuff that these trays have killed off and make sure everything is really clean and smooth. And then I'm going to ask you to wear your trays twice a day, morning and evening, again, 10 to 15 minutes. It works really well while you take your shower in the morning. And then again, before, you go to bed at night, for 3 months. And then when you come see me again, we'll see where we're at. Once we have achieved health and we're maintaining health and we're not seeing inflammation and bleeding, then you wear them once a day, long term, 10 to 15 minutes. Your teeth are going to get whiter. And that's pretty much how that works for me.
I love the way that you're explaining this. And the reason is, as our listeners, or especially if they're new grads or maybe even students, you're addressing the real problem, right? I think that we've been so always talking about calculus. And you're like, look, let's fix the problem first. And then, by the way, we'll get stuff smooth. We'll clean up all the junk,
right.
the little local irritating factors later on. That's not causing the disease.
Right.
And I love that. I love how you're framing it.
Right. Right.
And how much easier it will be when you come back and that calculus is not as hard. It might even be so super gingival at that point, because I'm sure we've all experienced where that patient tissues, heal. There's some shrinkage, even post scaling, non-surgical stuff. You're like, oh, look at that little spicule there.
I have seen a couple of patients who the trays were so effective. I had one patient who came back and he just needed a prophy, and I was kind of blown away.
Wow.
Yeah.
I've had several patients who came back, and I, instead of doing 4 full quads of 43-41, I was doing 2 quads of 43-42 because
or
things
isolated,
had healed.
I would imagine.
Yeah. So. Yeah, significant changes just with using the trays. And like I said, it's so easy for the patient. You're not asking them to, cram their hands down and try to get in between teeth. It's literally just putting a line of gel. If you're trying to rebuild some bone, a few drops of antibiotic, and you just pop them in. Yeah, very, very easy to use.
So can I ask you about like elderly patients? And because I know that it creates quite the suction on the tray itself. Are any of the definitely more geriatric patients that might struggle with just, dexterity, arthritis.
Right.
Are they anybody really struggling to get those things out? Because even from like a partial and any new implant locators that I've put in, we've always had to make such adjustments to like pop it out because it was just so tough on their little arthritic hands.
Right. I have not run into that. I have one patient that I would say that we did not recommend them for him because he couldn't, he had his own denture that he was really struggling to get in and out. So, we did not recommend them for him. And I got to be honest, I don't have a huge geriatric base of patients, so I haven't really run into that a whole lot. One thing I have run into a few times is, and I get this question a lot, if you have someone that has really exacerbated inflammation, tissues, are really, really just inflamed, or you've got patients who, maybe need to get their wisdom teeth out, but they're not quite ready to make that move, or they need an implant in the future or a bridge in the future. Obviously, anytime you change the topography of the mouth, those trays aren't going to fit. So there are those patients that you may need to make a second set of trays for. Those would be patients who, like I said, have just inordinate amounts of inflammation and that tissue is just really, like out there. Or patients who have extreme bone loss, because the topography is going to change as things start healing and getting healthy. So, and that's up to your practice individually as how you want to do that. I mean, for us, if we have to do a second set of trays, we'll typically just charge them the lab fee that second time. But yeah, that can sometimes be an issue.
I think that's very generous. I mean, I'm always about giving things away that would make people healthier. Obviously,
I feel like if they've made the initial investment and then they've likely made other investments in, getting teeth out or getting implants done, I feel like, I want to work with them. Yeah.
And they're compliant with coming in for their routine appointments. And that's always an investment.
We carry the gel and the Vibromycin in our office. You can order it online either way. Through the pharmacy, but we carry it in the office, and I do that purposefully because it helps me kind of know where they're at with 100%,
compliance. Yes.
Yeah. The process to kind of get going with things is you can either do a digital scan if you've got an iTero in the office, and just send that over directly to Perio Protect, and then you will email your lab form and the Perio charting. This is a super cool point. So they not only use the scan or the impression to, make the tray, they also use the Perio charting because they designed that seal to push that gel to the base of those specific pockets. So it's really, really cool as far as the science goes behind it.
That is cool.
So you definitely need perio charting. And then what if you don't have a scanner? Can you do traditional?
You can also
alternate?
do impressions. I will say that the impressions need to be really good. Yeah. You don't want pulls, and you make sure you get all the way to the gum line, all the way to the distal of those last molars. You want them to be really quality. We were using monophase light body for a long time instead of alginate. Obviously, you can't really send alginate in the mail. That's going to shrink up. So if you're going to do that, you've got to pour up your own models, which as long as they're really great quality, then that's an option too. Like I said, turnaround time once you send them off is about 3 weeks. I usually schedule my patient back in 3 weeks to deliver.
So what are you doing in the interim? So, okay, you got that patient where you're like, I don't want to create any bacteremia, as you mentioned, but 3 weeks is 3 weeks of time that you could be gaining ground, right? So do you have them do any, do you just work on home care? Do you discuss diet? Do you discuss other factors that could then be implemented to make them healthier?
Well, all of those things. And I do encourage, not everybody chooses to do it, but I do encourage salivary testing because, and I'm not a big fan of using systemic antibiotics. No. But if I know we've got systemic conditions going on and I see that we're way above threshold and there's just tons happening in there, then I do feel like that's an important thing. But yeah, really focusing on home care. I love peroxide rinses. I mean, I'm a peroxide girl. That's what Perio Protect uses. It's and kind of a non-medicinal. All you're doing is oxygenating, which I think is really, really important. It really depends on what the patient's condition is and what their medical history looks like as to how much I'm going to encourage them to do subgingivally. I feel like most of my patients have waited this long. 3 more weeks isn't going to be the end of the world. But yeah, we do talk about, what are dietary, what's that looking like for you? What are you eating? What are you drinking a lot of? What is home care looking like for you? And yeah, we start trying to build good home care habits up until that delivery time.
Nice. And for fluoride that you put in there, is there any particular, like an MI paste or just maybe, I don't know, what's the other ones now?
I love the Carry Free 5,000 gel.
That's a good one.
Because it's also got the xylitol in it. And I know that Perio Protect in the new year is going to be releasing a new Perio gel that has xylitol in it as well.
Nice.
So I'm excited about that. I think that's a brilliant idea.
Yeah, I like their products.
Yeah. One other candidate I didn't mention that is an awesome candidate is any of your patients who are either trying to get pregnant or are pregnant or who have had history of miscarriage. We know that FN bacteria in pregnancy is brutal and can cross through and actually bore through the amniotic sac. And so I offer to my patients, any of my pregnant patients, hey, we have salivary testing if we just want to make sure that those levels are good and healthy. And I've seen a couple, pregnancy gingivitis is a very real thing. And I think so many patients just accept that as, well, that's what happens. And it's like, nope, that really puts you at risk. So let's make sure, let's see what's going on there first. I will not touch a pregnant patient who's bleeding with a scalar. If I can help it. And, I try to help them make the best decision to really make sure we know what's going on in there. But it's Perio Protect's a great thing for pregnant patients. And I have talked to many OBGYNs getting permission to, use that for patients. There are no contraindications for pregnancy. So that's a really great way to help your patients just have a really healthy pregnancy as well.
So can I just talk to that point? Because I see a lot of underserved population, more in the lower economic brackets, like the outreach, the mobile vans and stuff like that. Mm-hmm. What can I do for those patients? Because there is that financial concern as well.
Right.
I always put them on a nice bleach water solution.
Yeah. But
I would just love for them to be on some Perio trays. But of course, then we got patient compliance and, the transient community that I work with a lot of times. That's hard to keep up with as well.
Right. To keep them with you and to have access to be able to rinse them and clean them. And yeah, that's a tough one. I don't know that answer. I mean, yes, I would love to get everyone.
I always like to bring it back to that. I'm like, what can I do? Somebody give me an answer. it's not easy. I don't think there's one answer for that population.
Yeah. One thing I will say just in question about, like what does lab costs look like? What is, for if you're thinking I'm kind of interested in this, what does that investment look like? You're looking at about $200 for your lab costs. That's an upper and lower tray together. You can separate them out. I have some patients that I have on just one tray because maybe we're trying to, regain some bone around an implant, or maybe we've got a bony defect that we're just trying to work on and keep clean and rebuild. So you don't have to do both trays together. Most patients will want the other one later because they want that whitening aspect to even out. And the national average fee that most practices are charging for the trays is about $800. So again, obviously each practice just determines what they want that profit to look like. The process is super duper easy, and Perio Protect is really responsive to their providers as far as providing training and support and materials. I love that aspect of it. If I have any questions, you're going to have them answered right away. They can send, obviously brochures for patient education. They have little zip drives you can put on the computer that patients can watch the videos in the chair. You can send them home to them, for how to take care of things, how to use them. Whenever they send you the tray, they send a little care guide with it so that you send that home with the patient, when they get home, if they've forgotten anything. So really, really user-friendly and really great support with the company.
And I think about all the patients that I've seen through the years in my perio practice where I would scale, I would Cavitron, I'd do all those things, and I just could never get them healthy. And of course, this was 7 years ago, and I didn't know what I didn't know. And things have very much evolved in the last 5 years that I think we've been on this podcast learning things. But I just think about, oh gosh, there were so many times where I was like, I don't think scaling and root planing is the answer here. Like, I'm not doing anything. There's no calculus. Like, I'm just putting scalar to tooth, and like, what am I doing? And I think that this and home care are just, they're really the answer in a lot of cases. Yes.
And you'll find Perio trays, a lot of my patients who use Perio trays are not like really that's the bulk of what they're doing. They're brushing and they're using Perio trays. I've got a couple that are pretty good about flossing, but I've got some who are really only brushing and using Perio trays, and the results are great, like consistent.
It's because you're creating that symbiosis, right? Like, you're not allowing that bacteria to become dysbiotic. And so you can have an accumulation, but it can still be a healthy homeostatic type of biofilm. Right.
Whereas we know when we are doing scaling and root planing, really we're just in there, scraping the tissue, damaging the tissue. It heals and, closes up, but those bacteria are still hanging out in there, no matter how well we're performing our scaling and using our ultrasonics and all of, flushing, irrigating, no matter how well we're doing all that, we're not sterilizing those pockets. And so that's the beauty of what Perio Protect does, is it allows that patient to eradicate those bacteria on a daily basis.
Well, and I also think like what a beautiful combo with airflow or some kind of subgingival biofilm management with like the powder followed by home care and the use of Perio Protect trays.
Right.
And, again, I don't get me wrong. I always joke, like, I thought I'd die with my Montana Jack in my hand and you'd have to pry it out of my clutch fist. And also, like, I wasn't ever sure if I was going to get past that high I get when I pop off a really good piece of calculus. But I will say airflow has definitely become my new drug, because I just love to see all that disclosing and solution just kind of fly away. Like, it's a very calming.
Yes.
But I think it would be so wonderful if one day I can get to a point where I'm not scaling, and like my hands are going to be happier, the patient's going to be happier, their teeth are going to be happier, and ultimately the patient will be more healthy.
Yeah, it's pretty amazing when just that month of difference between your initial perio charting, which, can be uncomfortable for them because there's infection. And then after wearing the trays for just a month and coming back to reevaluate that, they're already going, oh my gosh, you just did the same thing? Because that doesn't hurt. It's like, yep, isn't that amazing? So that's a good thing. I've had other hygienists ask me about, well, what's patient compliance like, because I can't get my patients to brush and floss, let alone wear trays. Sure. But when they see for themselves that when they come in to see you, it's not uncomfortable. Their teeth are getting whiter. And I'm a big proponent of celebrating your patients' wins with them, because that motivates them to continue. Sure. If they're excited that you're excited, and, you're praising what they're doing, and you're, sharing, oh my gosh, I can't believe, this pocket went from a 5 to a 3. This is amazing. This is, we've achieved health here. That motivates them to keep going. And it's fun.
Agreed with that. So the compliance thing, I guess, is something that I had heard, because I've known about Perio trays for a few years. Sadly, never did implement them into my Perio practice. Hindsight, I wish I would have. But I always heard compliance. But now that I am very familiar with motivational interviewing and helping patients be held accountable in their disease activity and really elevating the severity of their conditions, it's not just a little bleeding and just a little perio. I think compliance wouldn't be such an issue in my world. But I think if anybody is struggling with that, there are lots of ways to engage your patient, kind of really meet them where they're at and get them excited. Right. And I think you put it in a very easy way of explaining it. Like, it's just for a month, 3 times. I mean, give me yourself. I'll put a reminder right now on this thing 3 times a day. You put that, in, or just meeting them again where they are and be like, what times of the day work for you? When can you put these things in your mouth? 15 minutes. That's all we're asking.
Yep.
And really kind of build that patient compliance, because then it's a month and then it drops down, and then can you wear it all night long?
You can, but about 20 minutes that peroxide's done all it's going to do. It's gone inert. So it's not going to hurt you to keep wearing them, but you're not going to get more benefits. Cause I've had some patients come back and go, well, I couldn't get that 3rd time in, but I wore it for like 40 minutes instead. And I'm like, well, you're an overachiever, but unfortunately that didn't give us the time that we needed. But I will also say life is what it is. And sometimes patients come back and say, I couldn't do 3 times a day. I only did 2. And I'm like, okay, that's fine. Cool. Love it. And we get in there and it looks better already. So, they work. Obviously we want them to do the full amount that we're recommending, but some helps more than none. And I've had patients too that have come and they're like, oh my gosh, I ran out of gel 2 weeks ago. I haven't done them and I feel horrible. And I've seen a long carryover to where you haven't worn them for 2 weeks, but things still look really good and healthy. It's maintaining. Mm-hmm. You can also, another little nice trick is if you like to use anything like Orachix or Cetacane when you do your scaling and root planing, you can have them bring their trays to the appointment and put that in the tray and let them wear that for a few minutes. So it really pushes it down in all the areas. So that's a nice little
I like that
trick
idea
as well. Yeah.
Or even just like wear it on the lower while you work on the upper, and then flip flop, or, I don't know, keep it in on the lower and while you finish that quadrant or something. I think that's a great idea.
I've had a couple of patients have challenges for your patients that have like major gag reflexes. I've had just a handful that have said, I can't wear them both at the same time because it really triggers my gag reflex. So for those patients, we've kind of worked out a way where they wear, one in the morning while they're getting ready and then one in the evening before they go to bed at night. And that seems to be a good balance.
And I would even say, like, if those are those patients, like, oh God, that's a much bigger conversation. Like, let's look for tongue ties. Let's look for tethered tissue. Let's look at their airway. How do they sleep? Where's their tongue resting? I'm like, my brain just like fires up when I'm like, hear that. I'm like, oh, okay. Well, thank you for that feedback. I'm a little concerned by that. Let's talk about that. Because I've seen more tethered tissue in the last month than I have in a very long time, and it's disturbing.
Isn't it funny how they all come together like that?
Yes. They come out, and because I just took a course on something, and then of course, well, I mean, that's probably why, you buy a yellow car, you always see a yellow car. Like, it's just how it is.
Yep. For sure.
Now, is there anything that we did not tackle that you think would help people better understand the science behind Perio Protect, the peroxide, why that's, I mean, I think you did a great job explaining all of that, or how to get a buy-in from patients, or anything that we didn't talk about?
I don't think so. I mean, I like to hammer home, if we're talking about getting the buy-in from the patient, getting them to enroll, is really just helping them understand their condition and understand the benefits of those trays, not only initially, but for the long haul. Because, I have those patients that are like, wait, you mean I have to wear these forever? And I say, well, it's really up to you. It is a lifetime investment if you'll consider it that way. And I know 3 times is a lot at the beginning, but I wear mine in the shower, and I have a really healthy mouth because I'm kind of a geek about it. But I wear mine maybe 3 times a week in the shower. So I've seen it's really nice because for some patients, once they really, really get stable, it may be 4 times a week. So, there's some play with that once we get them stable. There's also some play with their perio maintenance interval with that as well, because we are really maintaining health. So maybe I'm seeing you every 6 months and doing perio maintenance instead of every 3 or 4. So it gives
great.
them,
yeah,
it gives them something to work toward too, and feel like, well, I'm not just stuck forever seeing you every 3 months and wearing these trays every day. And, some patients feel like they're hitting their head against the wall and still not seeing results. But, I think this gives them a way to really consistently stay healthy and work toward, a little more freedom in that area, if you will.
Yeah, absolutely. And if anybody has any questions, I will also say, for one, our CE coordinator, Lacey Walker, she's a hygienist, and she's a big fan of Perio trays.
Loves them. Yeah.
And and I think if anybody does have any questions and wants to find out more, you could definitely head over to periodontal.com. And if they have any questions for you, is there a way for them to reach out?
Absolutely. I'm happy for you to reach out to my email. I'm Charissa at bulletproofhygiene.com.
And that's CHARISSA.
Yes, at bulletproofhygiene.com. And I love Perio trays. I love helping people with them. So yeah, if anybody has questions, shoot me an email. I'm happy to help.
That would be wonderful. Well, thank you so much for your time, all your education, all your knowledge that you shared with us today. I think Andrew and I are going to give Perio Protect a try. Yeah. I definitely
always
want
say
to.
That's the first step, is get them for yourself. When you become a provider, they will do them for you at half price. So get them for yourself, get them for your team, because if you're wearing them and you understand what the patient is going through, that just helps. That helps for everything with enrolling and explaining and all that good stuff. So yeah,
absolutely.
Give it a whirl.
Yeah, and I don't have to wear my bleaching trays, so it sounds like
there you go.
Real win for me. Like bleaching in the shower sounds like a fantastic multitasking trick that I will happily do. So, well, thank you so much. We appreciate your time, and thank you to Perio Protect for bringing us this education today.
Thank you guys. I really appreciate it.